There are many complications that come with paralysis, but one of the most common is known as heterotopic ossification. So in this video, I'm going to be giving you information about heterotopic ossification, such as the causes, symptoms, treatment, and prevention. Be sure to let me know down in the comments below what experiences you have had with heterotopic ossification. There will be a link down in the description below to a website that has more information on heterotopic ossification. Heterotopic ossification, also known as HO, is the extra growth of bone in places that bones shouldn't grow, such as in muscles or in tendons. When heterotopic ossification develops, new bone grows at 3 times the normal rate, resulting in jagged, painful joints. One thing to note about heterotopic ossification is that it only occurs below the level of injury. The cause of heterotopic ossification after a spinal cord injury is unknown. However, there are several things that people believe might cause heterotopic ossification after a spinal cord injury, and these include trauma, immobilization, so being paralyzed and not being able to move around, muscle spasms, loss of oxygen, severe bleeding, inflammation, genetics, and prolonged pressure on the hips. Heterotopic ossification may develop within days, months, or even years after a spinal cord injury, but normally it occurs within 3 to 12 weeks after a spinal cord injury. In patients that have a spinal cord injury, 90% of heterotopic ossification occurs in the hips, but it can also occur at the knees, elbows, and the shoulders. Heterotopic ossification occurs more in men than in women, and also people in their 20s and 30s are affected more than any other age group. Now for the symptoms of heterotopic ossification. The main symptom is decreased range of motion due to the development of bone at the joint. Heterotopic ossification affects the ability to bend the hips, knees, elbows, or shoulders. Some things you may notice are redness, swelling, or warm temperatures that may develop at areas over a joint that has heterotopic ossification. This redness, swelling, or warm temperature can occur at the hip, knee, elbow, shoulder, or thigh. Heterotopic ossification may give you a fever or increased muscle spasms. The bone that grows from heterotopic ossification is often jagged, making joint movement rough and bumpy, which can be very painful. This joint pain and muscle pain can result in autonomic dysreflexia, which I do have a video on that if you are interested in learning about autonomic dysreflexia or AD. Now I'm going to talk about the effects of heterotopic ossification. When you can't move your joints freely, this can affect your ability to do transfers, bowel care, bladder care, and other activities of daily living. Skin breakdown or pressure sores can result from heterotopic ossification because it can increase the amount of pressure that is being applied to the tissue under the certain bony areas where heterotopic ossification is occurring. Blood clots or deep vein thrombosis can also develop due to the decreased movement and problems with circulation around the joints. Now to the diagnosis. Heterotopic ossification is diagnosed after you have some or all of the symptoms that I listed, and your doctor will order you to have tests done in order to confirm that the symptoms that you are having is related to heterotopic ossification, and some of these tests include blood tests, CT scans, or ultrasounds. Now to the treatment of heterotopic ossification. Treatment includes range of motion of the joints and other physical therapy, medications to slow down or stop the abnormal growth of the bone, or surgery if heterotopic ossification majorly affects your movement or causes you pain. Now to the final part, which is prevention of heterotopic ossification, and prevention includes range of motion in the joints and medications to prevent bone growth. One of these medications can be a blood thinner because it decreases the activity of vitamin K, which is an important component in bone development. And the second medication is a non-steroidal anti-inflammatory drug because it prevents the formation of bone growth by blocking certain cells from forming bone. I actually have heterotopic ossification, and it is in my left thigh because I broke my left femur whenever I was in my wreck, and they had to put in a rod going from my knee all the way back to my hip to stabilize it. So about 3/4 of the way down my thigh, you can see where extra bone is growing, and it is humped up maybe about like a 1/2 inch or 3/4 of an inch high, and it used to be bigger, but I believe it's gotten smaller because I've been doing range of motion with my legs every day since I got home from the hospital, and so range of motion can really help a lot. It doesn't cause me any pain, but the only thing that it really does is prevent my leg from bending all the way back like it should, like this. It only bends about that far back instead of going all the way back like my right leg does. Don't forget to let me know about your experiences with heterotopic ossification down in the comments below. Also, check out the link down in the description for more information on heterotopic ossification. Hopefully you found this video informative, and be sure to check out my other spinal cord injury related videos.